All right, gearing up for that clinical pharmacist interview.
You bet.
We figured.
Yeah.
So we're taking a deep dive into some of those common interview questions
Yeah.
from an Indeed.com article.
Okay.
But we're not just going to like rehearse answers. We're going behind the scenes to understand what these questions really reveal about what makes a phenomenal clinical pharmacist.
Yeah.
It's like unlocking the secrets to success. Right?
Yeah, it's really interesting how these questions go beyond just, knowing your medications.
Right.
They really sort of probe critical thinking, ethical decision-making, communication, how do you handle pressure, all that.
That's true.
Those are superpowers anyone can use, no matter what you do.
Okay, let's break it down. One question that really stood out to me was about like catching a potential medication error.
Oh, interesting.
I can imagine that takes some serious detective skills.
You're totally right. You are spot on, yeah.
What are some clues?
Yeah. It's about being that last line of defense for patient safety.
Right.
A simple error
Yeah.
could have huge consequences.
Exactly.
And pharmacists are trained to spot red flags, like maybe the dosage seems way too high.
Right.
Or a medication that could interact really badly with something the patient's already taking.
Yeah, that's scary.
Or, allergies, making sure that the prescription makes sense for the patient's diagnosis.
It's like they're really analyzing every prescription. They're not just, filling bottles. It's like they're piecing together this puzzle.
Exactly.
Yeah.
And sometimes the puzzle pieces don't quite line up.
Right.
The article mentions this great example where a pharmacist was double-checking this prescription for a high-risk medication and noticed something wasn't right with the patient's medical history. And so, thankfully, because they were so thorough,
oh, wow,
they caught the error.
It's huge.
Before it reached the patient.
Yeah.
Yeah.
That's a real-life example of why that attention to detail is so important.
Yeah.
Okay, moving on to another question that caught my eye was educating patients. And that makes me think about how pharmacists don't just, hand over medication.
Yeah.
They build trust and understanding. What does that actually look like?
You're right. It is a huge part of the job. The source talks about assessing a patient's health literacy, which is basically, how well they understand medical information.
Right. Yeah.
And so a good pharmacist will tailor their communication style, making sure to use really clear language, encouraging questions, all that.
So it's almost like being a teacher as well as a pharmacist.
Absolutely.
Yeah.
And, think about it. Clear communication is important in any situation.
Right.
Whether you're explaining, a project to a coworker or teaching your grandma how to use a new smartphone.
Yeah.
It's about getting your message across right.
Absolutely. Okay, now this next question is where I think things get really interesting. It asks about handling a disagreement with a physician.
Ooh.
So you've got the pharmacist with their medication expertise, right?
Yeah.
The physician with the diagnosis and treatment plan. What happens when those perspectives clash?
It definitely, I think, highlights the collaborative nature of healthcare.
Yeah.
The article emphasizes open and respectful communication, which is key in any professional setting.
Right.
Even more so when patient safety is on the line.
So it's not about winning an argument or proving who's right.
Right.
It's about finding that best solution for the patient.
Exactly. Both the physician and the pharmacist ultimately have the same goal, right? The patient's well-being.
Exactly.
Imagine a scenario where a pharmacist notices a potential issue with a prescribed medication. They need to be able to voice that concern clearly and respectfully.
Yeah.
Providing evidence to support their position while being open to hearing the physician's perspective.
It takes a lot of confidence and communication skills to navigate that kind of conversation.
It does.
Especially, maybe when you're dealing with someone more senior than you.
Yeah, absolutely. And that's a skill that translates to any field.
Right.
Think about a time when you had to, disagree with your boss or a teammate. How did you approach it?
That's a good question. Let's shift gears a bit and talk about staying up to date in a field that's constantly changing.
Right.
I mean, new medications and treatments are coming out all the time.
Yeah.
It must be a challenge to keep up with all the latest research.
It is. It is.
Yeah.
The article mentions various ways that pharmacists stay at the forefront of their field, like attending conferences, reading medical journals,
Right.
participating in online forums where they can discuss new developments with their peers.
So it's about being a lifelong learner.
Yes.
Constantly seeking out information.
Yeah.
Expanding your knowledge.
Yeah.
I think that's something our listener can relate to no matter what field they're in.
Absolutely.
We all need to find ways to stay ahead of the curve, right?
And in the fast-paced world of medicine, that's even more critical.
Yeah.
Right.
Before we move on, I wanted to touch on a few other fascinating questions.
Okay.
From the article. Like, how would a pharmacist handle a situation involving a potentially forged prescription?
That's where it gets really interesting.
Right.
Yeah.
Like, that sounds like a blend of detective work and ethical decision-making.
Absolutely.
A whole lot of pressure.
Yes.
Tell me more.
Well, let's save that for next time. We'll be right back to delve into the world of forged prescriptions and other challenges that clinical pharmacists face. Stay with us.
All right.
Yeah.
Sounds good.
Yeah.
We'll be right back.
We're back and ready to unpack some more of those fascinating questions about clinical pharmacy. Before we left off, we are about to get into the world of forged prescriptions.
Oh, yeah.
I mean, that sounds like a scenario straight out of a medical thriller, right?
It does. It does.
Yeah.
Imagine, you're a pharmacist.
And someone hands you a prescription and it just feels off.
Oh, wow.
Maybe the handwriting seems suspicious or the dosage is way too high.
Yeah.
You've got to make a decision and the stakes are high.
Right, right.
Yeah.
What are some of the, telltale signs that might raise a red flag for a pharmacist?
Well, pharmacists are trained to be incredibly observant. They're looking for anything that doesn't seem quite right, alterations to the prescription, inconsistencies in the doctor's information, maybe a medication that doesn't really match with the patient's diagnosis.
It's like being a detective almost.
Yeah.
Like analyzing every detail to determine if something is legit or not.
Exactly. And sometimes those suspicions are confirmed when they check the prescription against databases or even contact the prescribing doctor for verification.
Wow. Okay, so let's say a pharmacist, confirms that a prescription is indeed forged. What happens then? It must be a tough situation.
It is. It really requires this balance of professionalism and ethical responsibility. Right?
Yeah.
The pharmacist has a duty to protect the public from harm, so they can't ignore it.
Right.
But they also need to approach it carefully to avoid any false accusations, obviously.
So they might try to contact the prescribing doctor?
Yeah.
Or even involve law enforcement?
Exactly. I mean, the course of action might vary depending on the situation and the pharmacy's policies, but the priority is always ensuring patient safety and upholding ethical standards.
Right. It's a reminder that clinical pharmacy isn't just about dispensing medication. It's about making those judgment calls.
Yes.
That have real-world consequences.
Yeah, absolutely.
Speaking of challenges that go beyond the prescription pad, let's talk about drug diversion prevention. This was another question that really stood out to me. To be honest, I'm not entirely sure what drug diversion means.
Yeah.
Can you break it down for me? And why it's such a concern?
Sure. So drug diversion basically means that prescription medications are being used for purposes other than what they were intended for. So this could involve someone stealing medication, selling it illegally, or even using it themselves in a way that wasn't prescribed.
So it's about medications ending up in the wrong hands.
Yeah.
Or being misused.
Right.
I see how that would be a huge problem.
It is. It really contributes to a lot of serious issues, including addiction and accidental overdoses. Clinical pharmacists play a critical role in preventing drug diversion.
Okay.
And it really starts with being vigilant.
What does that look like? Are they like medication detectives searching for clues?
In a way, yeah, they are. They're carefully monitoring their inventory, watching for any discrepancies or patterns that seem unusual. And they're also trained to recognize those red flags in prescriptions, like, someone trying to fill the same prescription at multiple pharmacies.
Right.
Or requesting an unusually high quantity of a medication.
So they're paying attention to details.
Yeah.
Looking for anything that seems a little off.
Exactly. They're also on the lookout for signs of potential, doctor shopping, where someone goes to multiple doctors to get prescriptions for the same medication.
Makes sense. But prevention isn't just about, catching people in the act, right?
Yeah.
It's also about educating patients about the risks of, sharing their medications or misusing their medication.
You're right. You're right. Clinical pharmacists are in this unique position to educate patients about those dangers of drug diversion, the importance of taking medication responsibly.
Right. They're like advocates for safe medication use.
Precisely.
Yeah.
And they might also work with law enforcement, to report suspected cases of drug diversion, or even to help develop strategies for addressing the issue in the community.
It's inspiring to see how pharmacists are going beyond, the traditional role of just dispensing medication and becoming involved in those broader public health initiatives.
Absolutely.
Speaking of taking that holistic approach to patient care, let's shift to the final question that really caught my eye, which is medication reconciliation during care transitions. Remind me what that one's all about.
Yeah, so it's about ensuring that patients have a smooth and safe transition when they move between different healthcare settings. So imagine someone being discharged from the hospital after surgery.
Yep.
Or they're being transferred to a rehabilitation facility. They might have a whole new set of medications, and those could potentially interact with their existing prescriptions.
Oh, wow.
Or maybe they're even completely unnecessary.
It sounds like there's a lot of room for error if that communication between healthcare providers isn't totally clear.
You're absolutely right. That's where clinical pharmacists play a vital role. They act as medication detectives, carefully reviewing the patient's entire medication history.
So they're piecing together a complete picture
Yeah.
of the patient's medication regimen.
Exactly. They're looking at everything: prescription medications, over-the-counter drugs, herbal supplements, even vitamins. Anything the patient is taking could have an impact on their health.
Wow. It's like they're putting together this giant medication puzzle. Yeah.
To make sure all the pieces fit together safely and effectively.
That's a great analogy. They're also communicating with the patient's other healthcare providers, the doctors, the nurses, the specialists,
Right.
to clarify any discrepancies and make sure everyone's on the same page.
It sounds very collaborative, with the pharmacist being that central point of contact for all things medication.
Precisely. And by ensuring that medication reconciliation is done really thoroughly and accurately, clinical pharmacists are playing this crucial role in preventing medication errors, reducing hospital readmissions, and ultimately improving patient outcomes.
Wow. It's clear that pharmacists are wearing a lot of hats.
They do, they do.
They are educators, advocates, detectives, guardians of patient safety.
Absolutely. It's a multifaceted role that requires a really unique set of skills.
It's true.
And a deep commitment to patient well-being.
It's really a fascinating and rewarding profession. It is. It is. What's remarkable is that all these skills, critical thinking, attention to detail, communication, ethical decision-making, those are valuable in any field.
Absolutely. It seems like there's always more to learn about the world of clinical pharmacy.
Always more to learn.
But we've covered a lot of ground today. Any final thoughts before we wrap up this deep dive?
Just this. Remember that even if you're not planning on becoming a clinical pharmacist, the insights we've gained from these interview questions, they can be applied to any career path or even your personal life. It's all about, cultivating a mindset of continuous learning, being curious, embracing challenges as opportunities for growth.
I love that.
Yeah.
So keep those questions coming, stay curious, and never stop exploring. We'll be back next time with another deep dive into a fascinating topic. Until then, happy learning. Welcome back. It's amazing how much we've learned about clinical pharmacy just by going through these interview questions.
It is. It is.
It's clear that it's, so much more than just knowing your medications.
Yeah, we've seen how clinical pharmacists are problem solvers, detectives, educators, advocates for patient safety. They're constantly thinking critically, analyzing information, making decisions that have a real impact on people's lives.
It's like they're playing this high-stakes game of chess.
Yay.
Where every move matters. And they're doing it all while staying up to date in a field that's constantly evolving.
Exactly, yeah. Think about, how rapidly new medications and treatments are being developed.
It's crazy.
They have to be lifelong learners. Always seeking out new information, adapting their knowledge to provide the best possible care.
It makes you realize that continuous learning isn't just a buzzword.
No.
It's essential.
It is.
For success, I think, in any field, but especially in healthcare.
Absolutely. Yeah, whether you're reading research articles, attending conferences, or even just having conversations with colleagues, it's crucial to stay curious and open to those new ideas. And that's something anyone can do. Regardless of their profession.
I think this deep dive has really shown how transferable a lot of these skills are.
Yeah.
It's not just about acing a clinical pharmacist interview.
Right.
It's about developing a mindset that'll help you really thrive in any career path.
Absolutely. Whether you're facing a complex problem at work, navigating a tough conversation, or even just trying to make an informed decision, those skills we talked about today can make a world of difference.
Yeah, that's so true. So as we kind of wrap up our exploration of clinical pharmacy, What's one key takeaway you'd want our listener to walk away with?
I'd say this: never underestimate the power of curiosity and continuous learning. Whether you're passionate about healthcare, any other field, embrace that challenge of expanding your knowledge, asking those questions, seeking out new perspectives. That's how you grow, both personally and professionally.
Beautifully said. And remember, this deep dive, this is really just scratching the surface. There's a whole world of fascinating topics out there waiting to be explored. So keep that curiosity burning. Keep asking those questions. Keep on learning. Until next time.